Did you know that Australia has one of the highest rates of antidepressant use in the world? With nearly 1 in 7 Australians taking these medications, it's time to talk about the growing need for safe and effective deprescribing. Antidepressant use has been climbing steadily, particularly in Australia. Around 3.9 million Australians are currently on antidepressants, with 92% of these prescriptions coming from general practice. That's a staggering number, and what's more concerning is the rise in long-term use. Long-term use is generally defined as taking antidepressants for more than 12 months. But here's the kicker. Many people are staying on these medications not necessarily because they need to, but because they don't know how to stop. That raises some pretty big questions. Are these medications really working effectively for that long? Are they still necessary, or have they become more of a habit rather than a treatment? The truth is, the idea of long-term use often starts with good intentions. Maybe someone had a major depressive episode or an anxiety disorder, and their GP prescribed an antidepressant to help. And it probably did help, at least in the short term. But fast forward a few years, and the prescription is still being refilled month after month, with very little discussion about whether it's still needed. It's like signing up for a gym membership to get fit, but years later on, you're still paying even though you haven't set foot inside for ages. The routine becomes automatic and unquestioned. And for many, it's not because they want to stay on the medication forever, it's because coming off feels next to impossible. The evidence backing long-term antidepressant use is surprisingly thin. Most of the research out there is focused on short-term effects, weeks or months of treatment, not years. And this is according to Professor Wallace, who says most of the research into antidepressants has been short-term studies. Very little research looks at the effects, good or bad, beyond a year. And yet millions of people remain on them for years, sometimes decades. It's almost like buying a car based on a one-week test drive and then signing a lifelong lease. You just wouldn't do that, right? But that's essentially what's happening with antidepressants. To be fair, some people do benefit from long-term use, especially those with chronic recurrent depression. But for many others, the question isn't just about whether the medication helps, it's whether it's still necessary. Now let's talk about the flip side, the risks, the side effects. The research is starting to shine a light on some of the downsides of long-term antidepressant use. These include lethargy, weight gain, emotional numbness, and sexual dysfunction, sometimes even permanent. There's also an increased risk of falls and fractures, especially in older adults. Lethargy and fatigue can make it hard for people to maintain energy throughout the day, sometimes leading to a cycle of inactivity and low mood that's hard to break. Weight gain is another common issue, and not just a few kilos, it can be significant. For some, this weight gain can lead to other health problems, including hypertension or diabetes. Then there's emotional numbness. People describe it as a feeling of being flat, like they're walking through life with the volume turned down. Sure, the extreme lows might be softened, but so are the highs. Life's little joys, the moments that used to spark happiness, can feel muted. And sexual dysfunction? Well, that's not just a side effect, it can be life-changing. Some people experience problems that don't go away even after stopping the medication. That's a pretty big deal, yet it's often brushed aside during consultations. And think about this. If these side effects were happening with any other long-term medication, wouldn't we be a lot quicker to reconsider their use? Professor Wallace puts it plainly, these drugs were never meant to be used for life. But here we are. If you're wondering why people don't just stop taking antidepressants, it's not that simple. For many, attempting to stop antidepressants triggers withdrawal symptoms that can be pretty severe. We're talking about nausea, dizziness, insomnia, and even feelings of anxiety or depression, sometimes for months or even years. And here's the tricky part. These symptoms often look exactly like a relapse of depression or anxiety. Imagine you're trying to get off a medication, you feel worse, and suddenly you're told, oh, your depression is back. Naturally, people go right back on the medication, believing they still need it. But often it's just withdrawal, not relapse. A lot of this comes down to awareness. Patients don't always know that these withdrawal symptoms are temporary, and unfortunately, not all healthcare providers are well versed in distinguishing between withdrawal and relapse. The lack of clear guidelines for tapering off safely often makes things worse. Many people try to cut their dose in half or quit cold turkey, methods that almost guarantee uncomfortable symptoms. But there is hope. The University of Queensland has stepped in with a new initiative called Release, which is redressing long-term antidepressant use. This program is designed to make discontinuation safer and more manageable. Release provides step-by-step, drug-specific tapering plans. It is not a one-size-fits-all approach. There are multiple options for tapering, some faster, some incredibly slow, based on individual need. It also helps people understand the difference between withdrawal symptoms and actual relapse, which is a huge thing. And it's not just for patients. There are resources for healthcare providers and support networks too. Release has even been accepted as a clinical resource by the Royal Australian College of General Practitioners. This isn't just an idea, it's real evidence-based support for those looking to step down safely from antidepressants. The rise in long-term antidepressant use is a major public health issue. For some people, these medications are life-changing and necessary, but for many others, they've become a long-term commitment without much thought to the risks or the possibility of stepping down. Programs like Release are crucial in changing that narrative. They give people the tools and the knowledge to taper off safely, and more importantly, they challenge the idea that antidepressants are a forever solution. So if you or someone you know has been on antidepressants for a long time, it might be worth having a conversation with your doctor about deprescribing. With the right plan and support, it's not just possible, it's safe. That's it for part 1 of our 3-part series on antidepressant deprescribing. My name is Dr. Ferghal Armstrong, and this has been Cracking Addiction.